Thank you for joining us today. And I'm really glad and pleased to have Rebecca Petris as our speaker. She is from the Dry Eye Foundation, all the way from Washington State, joining us on Zoom. I will let Rebecca talk about the foundation and about herself. It's better to hear it from her than from me. So Rebecca, the mic is yours.
All right. Thank you so much. I'm really happy to be with you all today, and I just really appreciate being invited. Yeah, my name's Rebecca. I'm near Seattle, western part of Washington State, and I've had mild vision impairments and dry eye and chronic eye pain since 2001 when I had LASIK eye surgery, which unfortunately for me went a bit awry. When that happened, I ended up connecting with people online who were struggling with similar things. And I kind of naturally slipped into an advocacy type role, helping people. It became a passion for me. And before long, I was doing it full time. So for the last 20 odd years, I've been working in kind of community support and education and advocacy specifically for people who are struggling because their eyes are constantly hurting or uncomfortable, generally related to some kind of corneal disease. And the specific reasons are like all over the map. Maybe they had laser eye surgery like me, or maybe they had a blepharoplasty and their eyes got very dry after a lid surgery. Maybe they've got an autoimmune disease like Sjogren's. Maybe they've had radiation or chemotherapy or had a tumor removed that damaged the nerves in their lids. Maybe they're women who hit menopause and all of a sudden their eyes are bothering them. Maybe they're 20 years old and used an acne medication that caused them severe dry eye. Maybe they've got a rare disease, they've had cornea transplants, or there's also lots of people who've got no other medical issues at all, and doctors don't even understand why their eyes hurt all the time. So the one thing that they all have in common is some form of dry eye, or as we prefer to call it, ocular surface pain. And in the community that our organization serves, Dry Eye Foundation, some folks have perfect vision and others have vision impairments or vision loss in one or both of their eyes. And I think we all know that eye disorders in general bring lots of different types of challenges at the same time. We've got the medical challenges, finding the right doctors, getting accurate diagnoses, getting the best treatments we can. We get financial challenges. How do we pay for care, pay for drugs and procedures, dealing with income loss, navigating insurance, just becoming a bigger and bigger issue, I think, these days. Then there's the biggest, the practical challenges. How do I navigate the world with this condition or disability? What do I accept as losses? What do I fight to try to gain back? How do I work? How do I play? How do I get from A to B? If I've got some kind of chronic or progressive disease, how do I manage it day to day? And then there's emotional challenges. That's the real whopper in my view. There's the stress burden from all the other challenges, and there may be some significant losses to grieve too. So the mental health piece, I think, in eye disorders is huge. And in my experience over the years, both personal experience and just working with others, when you're dealing with any kind of new vision impairment and at the same time you've got significant dry eye or eye pain issues going on, that combination is especially hard. So I often hear things from people like, I could deal with the vision issues if I just weren't in so much pain, or the opposite. I could deal with the pain if I could just see. So anyway, when Nick and Tara from Prevention of Blindness Society reached out to see if I would come talk with you, I was excited because I figured you might be my kind of people. So I'm going to share a few slides, and it's really just to kind of keep me from going off on tangents too much because I do that. So bear with me a sec while I get that started. All right. Are we good, Tara?
Yes.
Okay.
Mhm.
Thanks. So my topic is nominally dry eyes in winter. I realize we've only got like 2 days or less left in winter, but everything I'm going to share is honestly just as valid all year round. And I want to start by talking about what dry eye is and what's making it happen so much. I mean, 30, 40 years ago, dry eye was not really a thing. There were no dry eye drugs. There was only a handful of over-the-counter lubricant drops. The only eye drop most people ever even heard of was Visine. Today, we've got 8 FDA-approved dry eye drugs. You're probably seeing commercials for them on TV. In fact, yesterday, the FDA rejected a ninth one that wasn't quite good enough. And there's hundreds of eye drops out there, and there's this enormous industry churning out all kinds of treatments and products for dry eye. So, what is this thing that we're calling dry eye? First of all, dry eye is actually the wrong name. It's inaccurate. For most of us, it's not about the eyes being actually dry. The name is also trivializing for a lot of people. I mean, there's plenty of people who have mild dry eye for whom it's no big deal, but there's also millions who have symptoms that affect their lives profoundly. Severe dry eye symptoms can be debilitating. So the term dry eye refers to actually two whole kind of categories of things. On the one hand, we've got ocular surface disease. Ocular surface disease is basically anything that can go wrong on the surface of my eyes. That's the cornea and the conjunctiva, those tissues and the tear film that covers them. And ocular surface disease includes several different types of dry eye, as well as a few other kinds of disorders. There's things like aqueous deficient dry eye, where the tear glands aren't producing enough moisture, and evaporative dry eye, where the oil glands in the lids get inflamed and stop putting out the oil that keeps our tears from evaporating. There's also conditions where our lids aren't closing fully, leaving some exposed areas that can get damaged. And there's other conditions like allergy symptoms in your eyes. All of that is the medical side of dry eye, the clinical signs, things they test for, diagnoses, and so on. Ocular surface pain is the other half. It's the symptom side. What are you experiencing? And that's different for everyone. When you have dry eye, your eyes may feel dry or not. They may water. Watery eyes are actually a classic symptom of some types of dry eye. Your eyes might feel gritty. You might feel like there's something stuck in your eye. You might be acutely sensitive to wind or smoky environments or air conditioning. You might be always uncomfortable with bright lights or fluorescent lights. Your eyes might feel like they're burning or stinging or constantly irritated. Your lids might feel heavy. Your eyes might be painful or sore or achy. You might have one or two or five or everything on the list or other things. But as a category, the proper term for all these things is ocular surface pain. So we've got the disease side, ocular surface disease, and the symptom side, ocular surface pain. At the doctor's office, ideally, both of these things get fair play. I sit down, my doctor looks at me through the slit lamp, and they see what they see. And I tell them what I'm feeling or experiencing. They see the disease side, signs of ocular surface disease if I have it. I feel the symptom side, ocular surface pain. However, what the doctor sees and what I feel may not match. That is a classic problem, actually, in the dry eye world, and it leads to a lot of confusion and frustration. The doctor may see something mild and not think it needs any treatment, but I might be experiencing moderate or severe symptoms. Next, what causes dry eye? So I mentioned some examples back in the beginning, but there are many more potential explanations. The highest risk category has always been older women, but there's so much more to the story. Today, people of all ages and genders are getting some kind of dry eye, and they often have multiple contributors to it. It's like a giant puzzle. So, on the one hand, we've got eye conditions, lots of eye conditions that can affect our tear system and cause dry eye symptoms. Then there's the eyelids, things like blepharitis, styes, lids that don't fully blink, nerve damage. Then there's the systemic contributors, thyroid disease, skin conditions, diabetes, autoimmune diseases, and lots more. And then there's what we call iatrogenic contributors. It's a fancy word for side effects from medications and medical treatments and surgeries, which are actually a huge explanation for a lot of dry eye situations. But the bottom line is it's complicated, and those of us with dry eye often have more than one cause. So causes or underlying diseases or conditions are not the same as triggers or exacerbators, things that make you feel more dry. I just want to mention two of the biggest dry eye triggers. Thankfully, they're both things we can control or compensate for a lot of the time. There's environmental factors. Those are huge. Top two of those would be dry air and moving air. This is why winters are so hard, because we're all indoors with this dried out, heated air being pumped around. Second trigger is not blinking. Anytime you're staring at something, especially computer, TV screens, whatever, your blinking frequency takes a big nosedive. And as a result, your lids aren't secreting as many tears. For someone who does not have dry eye, this may not be a big issue, but if you do have dry eye, slowing down your blink rate can make you uncomfortable much more quickly. So that's one of the practical things that people often have to address. Now I just want to touch briefly on dry eye treatments. Going to go back to our two halves of dry eye, ocular surface disease and ocular surface pain, because they kind of have their own pathways for improvement. Ocular surface disease, the medical side, there is a huge number of medical treatment options today. As I've mentioned, there's drugs. We've got 8 FDA-approved drugs. There's many more on the way. There's additional drugs used off-label. There's compounded drugs. Then we've got devices like punctal plugs to trap more tears in your eyes, or eyelid weights for people whose lids aren't fully closing, or scleral lenses. That's something I use both for vision and dry eye, or other specialty contacts. There's lots of in-office treatments for the eyelids with other medical devices. That's a very popular treatment path these days. There's biologics like eye drops made from your blood or amniotic membranes. The options are kind of endless, which is great. Unfortunately, many of them are cash pay only and expensive. And while there's a lot of things that are quite effective at the disease side, none of them are guaranteed to make your eyes feel better, or they might take a long time to do so. But the good news is there's so much we can do to manage dry eye symptoms and improve our comfort through non-medical means too. That's what I call self-care. And I want to cover 4 key areas of this, getting onto some just very practical stuff. If you've got questions, I mean, we can do lots of Q&A at the end, but I would say don't hesitate to speak up if you've got questions while I go along, because we're getting into the really practical, how do I manage this day-to-day type of thing. Also, let's see. So going to start here with eyelid care. The most common form of dry eye starts in the eyelids. So keeping your lids clean and healthy is good prevention for everyone. Any of you who have been, diagnosed or treated for dry eye, you probably already know something about what this is all about. what does lid care mean? It's really two halves. There's hygiene and there's heat on the lids. So some kind of daily eyelid cleanser is for the eyes, it's like brushing our teeth. Um, it used to be common practice to use diluted baby shampoo to clean the lids, and that was a wonderful, nice, and cheap way to do it. Unfortunately, the recent research is finding that while this may help blepharitis, it's actually not great for dry eye. So using something that is designed specifically for the eyes is really a better pathway. Um, there's a lot of products out there. Lid cleansing things like wipes and foams. I'm just realizing I think I want to turn off the slides so I don't know how well people can see me, but I do have a little bit of show and tell here to do. Okay. So there's things like little like AquaSoft wipes. There's about 100 brands out there now where you are using some kind of wipe to just cleanse your lids. Some people do this once or twice a day. They come in all different forms. The one that I like that's cheapest but still medically really good is hypochlorous acid solutions. A lot of them, you can get some of the big bottles at a pretty low price. Most doctors recommend some form of those. They do a great job. The other part of lid care is warm compresses. So that would be things like Brooder bags, any of these microwavable type compresses that you get at the drugstore. You can make your own using like a rice baggie or something. Um, the using heat on your eyes is really between you and your doctor. It's very common advice. You're going to see this everywhere online that um, people do warm compresses regularly, but not all doctors recommend it. So it's certainly something to talk with them about. So that's just kind of good lid care in general. You might be given more specific things if you've got some kind of blepharitis that your doctor wants you addressing. Next, want to talk about protecting our eyes at night. This is one of the big practical issues our dry eye community struggles with. And the reason that it's a problem is tear production, our ability to secrete tears, it drops while we're sleeping. That happens for all of us, but for those of us who also have dry eye, that means things will often get worse at night. Many people have eyelids that don't close completely, and that's also a big exacerbator for people with dry eye. There's other conditions that like corneal dystrophies that can make nights really hard for people. And then there's CPAP users. If you've got a CPAP mask on and it's venting air upwards into your eyes, that can be a huge problem for people with dry eye, especially if their lids don't close fully. So, what kinds of things can you do to protect your eyes overnight if you're getting, say, you're waking up in the night with your eyes hurting or needing to put drops in, or you wake up in the morning with your eyes particularly uncomfortable, red, etc. So, two main pathways for dealing with this. One, lubrication. You want a good lubricant for overnight use, preferably something that's preservative free. It can be an ointment. That's the greasy kind of things that come in the tiny little tubes. Those are the things that last the longest. Not everyone can use ointments. I don't personally. They really disagree with my eyes. So there's also thick gels that you can put in that are water-based, so they'll evaporate. They won't leave the greasy residue, or sometimes just a thick drop will be good enough. The other half of night care is covering up. One of the best things that you can do if you get severe overnight dry eye is to keep your eyes covered to trap the moisture. just one caveat on that. You have to make sure your doctor knows you're doing it in case there's any eye condition going on that makes you higher risk for infection. But if your doctor okays it, there are lots of different things out there sold specifically for this. There's these like overnight goggles people use that will trap the moisture over their eyes and block anything from the heat or fans in the summer. Um, there's some shields that are made specifically for people who use CPAP masks that are small enough to fit under even the largest masks, but will block any air from kind of getting up into their eyes. Um, For people whose lids don't close, sometimes the best solution is actually taping their lids down at night. For that, you want to be using a really gentle silicone tape that won't be too rough on that delicate skin of your eyelids. When I first got dry eye, I was living in England, and it was like 2002 when we moved there. And like I said, back in that era, we just didn't really have anything for dry eyes. There was a couple of different drops, and that was about it. And my dry eye was pretty severe. The nights were the worst, and I was kind of crawling the walls. What I ended up doing was back then, I would put ointment in, and then I would take plastic wrap and cut a couple of squares of it and just pat one square down over each eye. So again, it kept out any moving air. It trapped all that moisture in. That was what got me through the night for a long time. So you don't have to be buying expensive products to get good protection at night. Simple things can work as well, but it can take a lot of experimentation to figure out what's going to give me enough protection, but it's not, some big, giant bulky mask I'm wearing on my face that's going to distract me or keep me from sleeping well. So finding a balance there is what that's all about. Next, I want to talk about the use of protective eyewear during the day. So this would be for people, mostly people who've got really bothersome symptoms. One of the best and most cost-effective non-medical things you can do to keep your eyes more comfortable is just keep them under cover. Um, I've got these ones that I wear myself. They have these little silicone shields in them that fill the space between the frame and my skin. And for me, those work great, but it doesn't have to be something fancy or designed for the purpose. You can use a simple safety goggle, even. I mean, I used to use something like this while driving back in the day. I would put them on over my glasses. They don't obscure side vision or anything. They trap moisture really well. You can get a safety goggle for $5 or $10. They look stupid, but if we're talking about just getting more comfortable in the privacy of your own home, it is a great way to just ratchet down that pain. So um, covering up, I think, is a really big deal. I speak frequently with people who have spent tens of thousands of dollars on dry eye treatments, and yet many of them often find that at the end of the day, things like glasses, practical stuff, gives them more predictable relief from their symptoms than anything else. I want to go on now to eye drops, which I think is a pretty big topic. Anybody with dry eye pretty much uses eye drops, but I thought I'd stop now. Anybody got questions? Anything you want to jump in on stuff I've covered? I feel like I've just talked a lot.
I I had a question, if that's
Sure.
there. Hi, my name is Shannon,
Hi,
and
Shannon.
sorry to join a little late. You mentioned the protective eyewear, and I think that's really awesome. I wear it a lot when I'm out. Sometimes what stops me from wearing it at home is the pressure on my nose
Oh,
that can happen. Um, or have you come up with any solutions that you've seen works when you were using protective eyewear for a long period of time.
Right. And I've talked with plenty of people where, like they need like super light glasses or something. So
Yeah.
are you wearing a specific, these are like the Siennas. What kind do you have?
Um, to be honest, I was considering getting some safety goggles
Uh-huh.
for dusting and cleaning because I'm very allergic to dust, but also gets in my eyes under my contact lenses. But I've noticed if it's more than like an hour or so when I'm at home, that pressure can start to get to me because I'm wearing it so much when I'm out.
Right. Okay.
And if
So
you don't have an answer, that's fine.
I think trying to think of anything that's not gonna. So these ones have like the ones I'm wearing. They've got the little nose pads. Um,
Uh,
there's Stoggles. Have you ever come across those? They're
no,
not like a right to the skin seal, but let's see. Bear with me a sec. I'm gonna get a link and drop it in the chat.
oh,
They're
thank you.
probably the lightest weight thing that I know of. Um, Sorry for the gross long link there. And I know Zenni Optical, the dirt cheap Chinese glasses, they're starting to make things like this too that have those side shields on them.
Okay, thank you.
Um, those are some of the best options I know. I mean, there's custom moisture chambers, but they kind of cost the earth. I do know some people who went that direction specifically because they couldn't tolerate any of the other ones for long enough. Um, anyway, those are things I would first think of. Let's see. And yeah, I see in the chat, Marcia's asking what I got dry eye from. Actually, it was LASIK back in
Oh, LASIK.
2001.
Sorry.
Yeah. Um, Cataract surgery. Actually, I'm coming up on that.
Okay.
Uh, that's that's my next big hurdle. My vision's been going steadily downhill, and I'm the only driver in my household, so I'm trying to maintain my ability to drive. I have to be out of scleral lenses for a couple of weeks to get my consult. Anyway,
Anybody else has a question for Rebecca? Because I have one, if no one else does. Any questions? Okay. Rebecca, you mentioned the warm compressors, the one you put in the microwave.
yep,
Do you use anything between your eyes and these compressors, like something?
right.
What do
Yeah.
you use?
Um, so there's a few different things. Some people will use just like a tissue
Mhm,
uh, that they lay down underneath it. Some of the companies that make these have a cover, like a machine washable cover for it,
mhm, mhm,
like the Oasis brand mask does, and I think the Optase brand one. There's companies that also make these just disposable hygiene sheets for them.
mhm,
Bruder makes those. I forget. I know there's one other one, but I mean the kind of um, cost-effective and environmentally
mhm.
a friendly way would be those cloth covers, or some people will just cut a piece of cloth the right size and put it between. So yeah, it depends really on, I mean, some of these products are more washable than others. The ones that are not suitable for like immersion washing, then putting something down under it, I think is a really good idea.
Thank
Um,
you.
Anybody else? Okay, I'm gonna leap into the world of eye drops. Eye drops are kind of a universal thing. Like I said, if you've got, excuse me, dry eye issues, you're probably going to be using some kind of over-the-counter drops. I'm not familiar with your group, so I don't know kind of what level of knowledge everyone's got, but I'm going to start with some basics. Like, what kind of eye drops are we talking about? First of all, you really want to stick only with lubricant eye drops. It needs to say that on the front of the box. You want to be avoiding anything that says redness reliever or vasoconstrictor. There's a lot of combination drops out there now, 2-in-1, 3-in-1, 5-in-1, whatever types of things. And Something can kind of look on the front of the box like it's meant to give dry eye relief, but they may be sneaking a vasoconstrictor in there, and you really want to stay away from those. Redness reliever eye drops give you a double whammy. First, you got the rebound redness problem, then the preservative. There's a notorious preservative in literally all of them. We call it BAK or BAK, and it's known to cause or exacerbate dry eye. So using drops that contain that frequently over the long term can cause new problems. The one exception to that is Lumify, which does not have the rebound redness issue. And they recently released Lumify in a preservative-free version too. We still don't advise using even preservative-free Lumify on a regular basis, but when you need redness relief, special occasions, etc., that would be the go-to. Next, want to just cover some basic safety issues. Substandard eye drops are pouring onto the market. There have been a lot of issues in recent years. At the Dry Eye Foundation, we have a product safety program, and we've reported hundreds of eye drops to the FDA over the last 3 years. They usually deal with them, but it takes time. Back in 2023, some of you may have seen this in the news, 4 people died and 18 people went blind from cheap contaminated eye drops. They were a generic for one of the popular refresh drops. And a lot of people had switched to them because it was available on Amazon. There were like 3,000 positive reviews of them. I would say be safe, not sorry. Be really careful where you buy eye drops. I mean, back in the day, we always got them at the drugstore, the grocery store, a pharmacy of some kind. That is still the safest way to get eye drops because they have a controlled supply chain. It's coming from the manufacturer to an authorized distributor to the pharmacy. Online, it gets a lot more complicated. If you're buying eye drops on Amazon, you really want to make sure that you're getting them direct from the manufacturer, if at all possible. I'm going to put another link in the chat. So we have a website called eyedropsafety.org. A lot of information about safety issues. There's also a database where you can look up any over-the-counter drops sold in the US and see, are there safety flags? Is it on recall? Has there been any FDA warning? We have a kind of sophisticated flagging system in there so you can see any risks that you might need to keep in mind. On that website, we also have some guidance for online shopping, like specifically how to stay safe on Amazon. Actually, I think I might just demo this really quick, if you don't mind. Let me pull up a window here. And okay, I'm going to share once more. Okay, so looking up a drop on Amazon, say I want to find Sustain, and I get all these choices. I click on one. What you want to always be looking for is right under the product listing, there should be a thing that says visit the brand name store. So here it's visit the Sustain store. And you should be able to click on that and go to the manufacturer's Amazon store. If it just has a thing saying, for example, let's see, try to find a good example here. Yeah, like it just says brand thus and such. That means it's not coming from the manufacturer direct. It may or may not be an authorized distributor. That sort of stuff is really hard to tell on Amazon. Just bringing this up because part of our safety program, we've been monitoring some of the counterfeiting issues. And I mean, you'd be shocked at how much counterfeiting goes on, even of some of these relatively cheap over-the-counter products. The Bausch and Lomb products have had probably the worst copycatting issues. Lumify is one of the most successful eye drops anywhere, so it's been cloned umpteen times. But also some of the eye ointments our medical advisor on the board of the foundation accidentally bought a counterfeit Bausch and Lomb ointment, the Mira 128 ointment, a few years back, and we were so stunned by that. So again, careful with shopping online for these. Okay, next, maybe we talk about preservatives. It's, if possible, with or without dry eye, it's always best to stick with preservative-free. And the only reason not to really is it is extra expense. Preservative-free drops are more expensive. So we can talk about like some of the more cost-effective ways to get preservative-free drops. The rule of thumb out there in the medical world is it's okay to use preserved drops if you're, up to maybe 3-4 times a day. If you're using them more frequently, make sure it's preservative-free. And that is sound except for one thing. It assumes that all preservatives are equal, and that's not the case. If we're talking most brand name drops like Refresh or Sustain, maybe the Soothe brand, a couple of others, the preservative is going to be mild. So using that a few times a day for somebody who has not got severe dry eye, would that be fine? Yes, but the problem is all the others, the generics out there. You can have a generic for a popular name brand where they're actually using a different preservative, and they may be using the one I mentioned before, benzalkonium chloride. You just do not want to ever be using a lubricant drop that has that in it. So the thing with using preserved lubricant drops is you really kind of need to become a label reader and make sure that you're using a drop with a reasonably friendly preservative in it. If you ever have eye drop questions of any kind, we're kind of experts at the foundation. You can reach out to us anytime with questions about them or suggestions. I'll put in the chat afterwards just our phone and email and all that. We love addressing stuff like this. So going back to then preservative-free, it used to be the case that preservative-free eye drops were always in these little single-use twist-off vials, right? Now there's a lot more options out there. There are many preservative-free bottles that have filtration technologies to prevent contamination from backwash. So like in an ordinary eye drop bottle, you squeeze out a drop, it is sucking air back in, and it's sucking back in whatever ends up on the tip of the bottle as well. With the new preservative-free bottles, you get protection from that. So you can have a preservative-free drop in a bottle that you can keep around for typically up to 90 days. And there's a few different types of those. The most common ones are these bottles that have kind of a flat top on them. And so the Refresh, Sustain, some of the Optase brands and many others are in bottles like this. They're harder to use than regular eye drop bottles. You have to get used to how they work. They have to be primed. You've got to you turn it upside down, you squeeze once, and you squeeze gently, and you wait. They don't drop out one at a time. They kind of ooze a bit. It just takes some practice to use them, and people can get frustrated with that. But in some cases, it is actually more economical to use the bottle than to be using the vials. There's always some that gets wasted with vials. It's also, if you're into this, more environmentally friendly, obviously, to use a bottle than 30 different vials. Another type of bottle that's used just for one drop is that's called Evisia. That one it's a bit bigger than the first one and probably a little bit easier to squeeze. I know folks with arthritis sometimes have trouble with these preservative-free bottles, and it can take a little experimenting to find what works best for you. Then the last one, there's a bottle with a super pointy top, and this is very common in Europe, but in the US, it's pretty new here. There's just a couple of Optase brand drops like that, and it works in a completely different way. You're not squeezing the bottle. You turn it upside down. It has a pump on the bottom, and you pump it, and it just goes click, click, click. And I actually love this bottle because I get one drop every time. I don't get a flood. It's got a nice measured unit dose. So, excuse me, those are really practical. Then going back to the vials, I actually recently did a little study, pulled together all of the different brands out there to see what size are their vials or how many drops do you get out of a vial. And I was astonished at the range. So the quantity in those vials was anywhere from 0.3 mils to 0.9 mils, right? So the 0.9, that's 3 times as much in the vial as the 0.3s. So I've been keeping a little reference list around there so I can tell people, get the drops that you get the most bang for your buck. Okay, the one with the most in it might not be the longest lasting one, so you might have a reason, you might need to get the ones that have less in them because they work better for you. But if you're using drops very frequently during the day, then the ones that have the most in them are going to help you save some money. Which brings me to the whole issue of recapping the single-use vials. Technically, you're not supposed to do that. Of course, the instructions say use it and toss it. The reality is most people recap, and that reality is so widespread that an awful lot of eye doctors say it's fine to recap. Our advice on this is, 2 things really. One, for safety's sake, fine, recap it, but try not to keep it longer than 24 hours. There's a reason why eye drops have preservatives, and that's to prevent contamination. The longer you have an unpreserved drop sitting open, the more chances it can get contaminated, bacteria breed in there. You really don't want these sitting around forever. Another little trick that I use, because those of us with dry eye sometimes end up with little vials everywhere, right? I mean, I mostly have switched to bottles these days, but back in the day. So sometimes it's hard to tell what's an open vial from a not open vial. What I do is after I open a vial, I put the cap back on and I turn it clockwise so it's perpendicular to the vial. Then it's just really easy to spot that's an open vial. So I make sure and use it up that day. Let's see what next. Then choosing drops. I did a little video series recently where I kind of went on a little thing about how people tend to give up pretty quickly on finding a drop that's going to work for them. Everybody tends to end up with their favorites, but many people just feel like, gosh, I've tried everything and nothing is working here. Actually, there are an awful lot more options out there than it might seem like. Narrowing things down is tricky because the boxes or the bottles don't necessarily give us the information that we need to tell them apart. I think one of the key factors in an eye drop that makes it work for me or not work for me is the viscosity. How thick is it? Some people cannot tolerate thick drops. They don't want anything that's going to blur their vision. It really is an issue for them, then you're going to want thin drops. That's why something like Refresh Plus is very popular. There's others like the Evisia brand. There's Theratears. There's Optase Hilo Relief. Thin drops are great for getting like a quick feel good plus clear up my vision, but they're not necessarily going to give me relief from discomfort for very long. And so if for those who feel like, gosh, I'm just putting in drops all the time and feel like I'm way too dry, they're just not lasting long enough. It's often more about the viscosity or ingredients in there that can make some last longer. You may just need a different drop. Refresh Plus tends to be a hands down favorite, partly because it doesn't blur vision, so almost anybody can use Refresh Plus. Also, Costco has those wonderful 100 packs, so it's like the most cost-effective drop out there, but it's just not a long laster. So if you're needing something to last you longer, my top suggestion is actually eye drops with sodium hyaluronate in them. This is where most eye drops have been heading for the last 10, 15 years. Unfortunately, the state of eye drop labels in the US is it's just kind of a hot mess right now. Many of the most important ingredients in our eye drops are being listed in the inactive ingredients, where they're hard to locate and understand. The active ingredient may not tell you what you need to know at all. So there's been more need for people to become label readers. At the foundation, we have been really actively advocating for change on this. What's really happening is that the list of allowable active ingredients from the FDA for eye drops, this list was put together in the 1980s and it has never been updated. Nothing's been added to it. And so ever since then, the way industry comes up with better eye drops and newer eye drops is they come up with more ingredients to add that will make the eye drops better, and they put them in the inactive ingredient list. And that then when they're in that list, they don't provide the concentration of it. So then you can't compare which drop has more sodium hyaluronate or castor oil or whatever it is they're putting in there. So it's just become difficult. And again, if you ever have questions about eye drops and we can help, just reach out to us at the foundation. Let's see. Questions? Anybody got questions on eye drops? Dry eye drops or any drops?
You can unmute yourself or write in the chat or raise your hand, whatever option you like.
I have a question about generic timolol for glaucoma. Whether that typically has the, I think you said benzalkonium chloride as the, does that have, can you tell what preservatives are in those prescribed drops?
Yeah, bear with me one sec because I'm just going to look up. I've got a list somewhere here. Whoops. Right. So if it's the generic, I mean, 0.01% benzalkonium chloride, I'm pretty confident that's what, I mean, I'd have to find the specific generic to pin that down, but it's very unlikely to be anything else. There's very few glaucoma drops that have any preservative other than benzalkonium chloride, certainly not any generics. Benzalkonium chloride is used very widely because, first, it's extremely effective, and second, it's super cheap. And it's not like some evil substance, right? For some glaucoma medications, it's they do say that it may actually help improve penetration of the drug. But the effects of benzalkonium chloride on the cornea are cumulative. The more often you're plying your eyes with drops that have it, the more damage can come from that. So I think there's going to be cases where either there's no preservative-free or mildly preserved glaucoma med available for your need that will do what your doctor needs it to do. That is going to happen sometimes where they just need you to be on one despite it, and then we've got to just find other ways to compensate for it. Anyway, I think that was more than the question you asked, but yes, I think pretty confident if that would be benzalkonium chloride, and it should be 0.01%, which is the most common concentration in the glaucoma meds.
Thank you.
Any other questions? Rebecca, do you have any advice for us for our daily living lifestyle, what to change, these things?
Right. I think the lid care that I brought up, I think that's really good kind of for almost anybody. That's just good prevention. I don't personally do the warm compresses, but lid hygiene, you simply can't go wrong with that. I think environmental awareness is a big deal. Your enemies are dry air and moving air. So again, any kind of protection, just wrap around sunglasses outside are good. I had wanted to ask to what extent screen use is, a big part of your community's life, because I just don't know. I know that's a huge thing for dry eye, is time on the computer, time on a phone, time with the TV. Would it be useful to talk about that a little?
Yes, because I think it's a problem for most of us.
Okay.
And we forget ourselves in front of these screens.
I was excited when you said it, so yes, please.
Okay. All right. So computer tips. And by the way, I didn't really talk about our foundation resources yet, but we have a patient handbook that's got all kinds of practical daily living advice stuff in it too. It's available from the foundation in hard copy. We also have it online in a flip book and a PDF that you can, use a screen reader for. So
Great.
Screen time is the bane of the dry eye world in general. And the reason for it is, as I mentioned, the moment you start looking at a screen, you stop blinking. Blinking is critical to eye comfort and health because every blink is secreting more tears, ideally, as long as we got tears to secrete, and every blink is keeping your eye covered for a little longer, so it's preventing too much evaporation. When you start looking at the screen, your blink rate drops to a fraction of what it is normally. So even somebody without dry eye can end up feeling dry by the end of a long session on a screen. But for people with dry eye, we can get uncomfortable very, very quickly. So how do we compensate for that? A few things. First, and this is the least known but most important thing, is the level of your gaze. So if you are looking up versus straight out versus slightly downwards, now that's going to determine how much of your eye is covered by your lid. Your eyes are covered by your lids. The more of your eye that's covered, the less evaporation of tears you're going to have. So you really want to be looking slightly downwards, if at all possible. You can test this out really easily. Just try it. Try looking up at a screen and hold your eyes open for a minute. See how that feels compared to looking straight or looking downwards. Now, for me, I have two giant screens here, and it's kind of difficult to be looking down at them. So I have to sacrifice a bit just to be able to do things on big screens sometimes. But I do hike my chair up. Some people will just get like a taller stool or something to be looking down at their screen more. So that part I think is huge. If you don't fix that part, nothing else is going to help enough. Second, I would say use eye drops preventively. Don't wait until you're uncomfortable. You want to keep ahead of it, not be always trying to catch up. By the time you can feel the dryness, you've just got more going on the surface of your eye than you really want. So when you know you're going into, and this is good for both computer use and anything else, maybe there's other activities or being outdoors or whatever, before you start a thing or go to a place where you know you're going to feel more dry, get some drops in then, even if you don't feel bad yet. Just keep ahead of it. For me, I wear scleral lenses. I wouldn't be able to be on a computer without them, but I also still get dry and uncomfortable these days. So the moisture chamber glasses over the sclerals for me are important. For people who don't wear sclerals, moisture chambers can be super important to lengthen their time on the screen. So a lot of these things are like, how do I get more day out of my eyes? How do I just stretch it out a little further? Sorry, I just want to drop a link in the chat on that guide.
And we have 2 questions in the chat as well.
Okay. And let me just think of what else I wanted to say about computer use. There are desktop humidifiers. Some people use those. And I would say be really aware of vents, ceiling vents and things. That's a big deal. That's another reason why some kind of protection to keep that moving air out matters a lot. So just put a link into the chat to the dry eye handbook. Okay, let's see. Does facial skincare impact dry eye? Do you mean like
even creams and
yeah, absolutely. So I didn't get into that at all. Skincare and cosmetics and aesthetic stuff in general, huge deal for dry eye. You really want to avoid getting things near enough that they can migrate into the eyes. So it's an awful lot of products that can really contribute to issues. We did a bunch of surveying on this years back of all the different things that people might be using that could kind of contribute. There are, I don't have something handy now, but I can get them, lists of like products or brands that have eye-friendly ingredients. I think that can be important. Let's see. Also thinking of shampooing, etc. Not quite sure what you mean by that.
like the shampoo, hair shampoo. I think that's what you mean,
Yeah, like
Shayma.
if it gets in your eyes,
Getting
like
in your
back in
eyes,
the day,
right.
they used to have the tear-free shampoos. Yeah.
Right. So any detergent, so-called detergent, I mean, anything with a soap in it is going to break up the tear film. So bad for the eyes. Trying to, shampooing in such a way that you can't get any in your eyes obviously is best. Personally, I kind of struggle with this, not actually because of the shampoo, but water bothers my eyes terribly. So, trying to make sure I don't get water in my eyes when I'm showering, I find that a challenge, but you find ways over the years. Yeah, anything that gets in there, either seeping in from the skin or getting in when you're washing your face or things like that, you want to be really conscious of keeping those things out. Our tear film is that layer of tears is incredibly sophisticated and smart, but it's fragile. And I think I mentioned earlier, the most common type of dry eye or a part of dry eye for many, maybe most people these days is not so much about I don't make enough tears. It's about my tears evaporate too quickly because there's not enough oil and other substances in them to keep them from evaporating. Or I'm staring at the screen all day and I don't blink, so they're evaporating more. So being mindful of anything that can contribute to that can get in there and take a fragile tear film and just break it up entirely, I think really matters. That, again, going back to the lid care aspect. Let's see. Pomade.
Re-
Eye makeup
Rebecca,
remover
yeah,
pads.
sorry.
I'm going to have to plead gross ignorance in the makeup and makeup remover world. I'm sorry. I just don't know that world. I mean, if I can share some links afterwards, I can track down a couple of the experts out there that are really into that. There's a couple of there's eye doctors that have companies for this. There's like the gal that has We Love Eyes. Um, there's also an expert in our neighborhood, Laura Perryman, she's called Dry Eye Master online. She's really into all the aesthetic side of what things do, can hurt your eyes more or help them. Sorry, Tara, what were you were about to say?
No, I was saying it's almost 12 o'clock, but the topic's so interesting. I mean, do you have any last words of wisdom that you want to share with us before the time is over? Because honestly, I mean, it's all these things that we experience in our daily lives. So it was amazing.
So glad that I could do this. I really appreciate you inviting me. I thank you. It's been an honor to be here. I would say it's hard to generalize about anything about dry eye because it's this big soup of so many different types of things, right? But yet, regardless of what the medical situation is, managing this day to day is absolutely doable. The devil's in the details, but if you are struggling with dry eye, there absolutely are solutions and answers for that. I also forgot to share our kind of resources for the foundation. We have support groups. We've got Zoom groups that meet regularly where we get into all these gory details about how do I manage this or that. My nights working on the computer, drops or lid care, they get into things like the cosmetics and skincare side much more as well. I learn from people in our groups all the time. Let me just plop the link.
Thank you. I can't give up my makeup.
Beg your pardon?
I said thank you because I can't give up my makeup.
No, I know it's an important thing. I think that's one of the kind of things we don't want any of these kind of chronic conditions to intrude too much into our lives. These things are part of our sense of self and who we are. We get to preserve that. We just got to find safe ways to do it that are compatible with managing the condition.
Rebecca, thank you again for joining us today. And thank you all. The recording will be out soon because I'm sure I am one of the people who will be going over this again. Take care, everyone, and see you next month in our next town hall. Thank you, Rebecca.
Thank you, everybody. Thank you, Tara.
Thank you
so much.
Thanks.
Bye.
Bye-bye. Bye all.